when that happened and, you went through the process, did anybody ask you about the vaccine, and did anybody try to even see if there was any connection?
No, not at all.
Did you raise the possible issue that, hey, is that a possibility?
Absolutely. We said they can't figure out. They ran a bunch of blood tests. We seen the hematologist team at Children's Hospital as well as UC Health Hospital, and all the tests came back normal. When I brought it to their attention, if this was a possibility that it was the vaccination, they automatically said, no, it's safe. The vaccination is safe. So as it started progressing and he started getting more blood clots and especially the one in his groin area that was 9 inches, we raised the question again in the hospital and with every doctor. And we said, can you scan his whole body? Because how do we know if there's other blood clots? So, and he does have, his last hospital visit, they did pull out another blood clot from his nose that was 5 inches long. So he has a blood clot, like Adrian said, in each of his lungs, one in each lung. They pulled out one from his groin area, which was the 9 inches, and then they also pulled a 5 inch blood clot from his nose. And they can't figure out why these blood clots are forming.
Now, we'll take a step back. With the COVID vaccines, both the Pfizer and Moderna, there are known documented safety concerns. They're rare, but they are there around cardiovascular problems. So the medical professionals didn't even acknowledge that, because that's in the FDA label. Okay, so they didn't even acknowledge that, right? That there is cardiovascular risks, mostly myocarditis, pericarditis, with especially young men, aged maybe 30 down to 12 is a higher risk category.